Did you know that body odor and dry mouth are symptoms of menopause? I didn't. Yeah, there are some unusual symptoms that might surprise you. Here to break them down so you know what to look out for is Dr. Marjorie Dixon. Thanks, Doc. So, before we even start, remind us how early menopause symptoms might occur or can occur.
They can happen as soon as in your 30s, like age 35.
Yep.
And spread all the way until you're 60.
Yep.
Average age is 51.
Yep.
And then the perimenopausal transition, kind of things start to happen, but it's not menopause yet because you still get periods regularly.
Right.
That's like 5 to 7 years before menopause at 51, so mid to late 40s.
So you might have perimenopause, then you're menopausal, which means you've had your period, you haven't had your period for 1 year, plus a day.
Plus a day, yes.
And then you're postmenopausal.
And then it's post.
And then you're post, okay. Let's talk about the vagina and the vagina tissue, which comes up again and again and again.
Yes.
What is happening during menopause?
Well, estrogen goes away, right?
Yeah.
You stop ovulating, so the eggs stop making estrogen, which stop making your uterus grow and shed that blood flow.
Right.
When
That's the
estrogen,
good news.
Well, it's good and bad. I don't know.
mean,
Like,
a lot of people, we just talked about on the show period pain, like it can be debilitating.
Sure.
So, I mean, it's good if it's over, if it's just hurting you.
I mean, the purpose of it really is so that we can conceive and prepare the uterus to receive an embryo. Once you're done having babies, it's kind of just extra.
Yeah.
Right?
Yeah.
But yeah, so when estrogen goes away, you get less blood flow to the vagina. Less blood flow to the vagina means less lubrication.
Right.
And you need moisture for penetration, and women don't feel comfortable when they get dry. And I think that people don't recognize that in that perimenopausal transition, you can have a vaginal hygiene routine.
Okay.
So that when you touch your vagina, it starts to feel different. Once you feel a little bit of dryness, use moisturizer. And moisturizer, like you do for your face, you can use that every day.
Okay.
And then when you have big moments of penetration, because sex is not all penetration, but if you have a big moment of penetration and you're feeling dry, use a lubricant.
Okay, so the moisturizing happens daily, and then the lubricant for just if you need lubricant.
If you need lubricant, and you can get these over the counter, you don't have to see a doctor for this stuff. I mean, when people talk to me about their vagina, sometimes I talk about hormones, but there are other things that you can do if you don't need to get there, because you can become menopausal and have transitioned nicely because you have a vaginal hygiene routine.
Okay, check that out. Okay, so we've talked about vaginal tissue. We have to talk about body odor. Yeah. So I can't say I'm that surprised by this, because if your hormones are changing, maybe things are changing, like the way your body works is changing. Yeah. So odor is a part of it.
Odor is a part of it, but it's also, remember we talk, one of the most pervasive symptoms are the hot flashes.
Yes.
Right, 75% of women postmenopausally or perimenopausally will have a hot flash. Well, your temperature regulator in your brain, called the hypothalamus, makes you flare up hot, right?
Yes.
And when you get really, really hot,
you sweat.
there you go. And,
Right.
And so your sweat glands are working overtime.
So it might be stinky.
And so you get a little stinky.
Okay.
But you can manage it, right? So the things that you do to manage is, one, make sure that you recognize the triggers, because a lot of women have triggers for the like wine and chocolate stuff that you like, really annoying people, your kids,
irritants,
irritating things can set you off. And so try to avoid them as much as you can. Right. Send them to the neighbors. But then wear like layers. Have water wicking clothing, so that if it happens often at night. So if your pajamas, don't wear the flannel pajamas anymore. Not a thing. No. So you wear like
put those away.
Water wicking cotton that you can strip quick.
Yes.
Have fans around you.
Yeah.
And then deodorant.
And then deodorant, right?
Or antiperspirant now. Deodorant for pre-menopause. Postmenopause, antiperspirant.
Antiperspirant. Oh, okay, good to know. Yeah, because you're going to perspire. This one I am a bit surprised about, dental problems. So what might be happening in our mouth in this period?
Well, so when estrogen goes away also, you have less blood flow everywhere, less moisture in your mouth. Yeah. Your gums recede. When your gums recede, you know, like when they say about horses long in the tooth, when people get older, long in the tooth, your gums recede. Bacteria can get caught in there. So your mouth hygiene is also really important. The dentists are really happy with us postmenopausally because we need them.
Hold on a second. I think it's okay.
It's okay. So not only bacteria, but you can get halitosis.
Yeah,
Some women are
breath.
like, oh my gosh, I had really great breath before. Now I need a mint all the time.
Right.
And dry. So drink lots of water.
Yeah.
Keep good dental hygiene habits. Brush lots.
Yeah.
Beware.
Be
is
aware.
what it is.
Be aware.
Yeah, that's all you
I
can
mean,
do.
these are things that pretty much can all be treated, so you just have to be aware of
It's all manageable, but having these conversations so people don't feel like they're falling apart. You're
That's
not falling
right.
apart.
You're not falling apart.
You're transitioning into your best place.
Absolutely. Dr. Dixon, thank you so much. She's going to be back later to answer your specific questions about menopause. For now, we're taking a break.